Good morning, one and all. Myself, Dr. Rupa. Today, we are going to discuss some of the important causes of female infertility. Recently, we have made a video regarding the male infertility. Okay, we'll divide the topics and we'll discuss so that you can easily understand it. What are the causes of female infertility? Okay, now we take the female reproductive system. See, this is the ovary. This is the fallopian tube. Okay, this is the uterus. This is the cervix and this is the vagina. So, if there is any problem in any of the part, it leads to the infertility problem. Okay, in case of ovary, the percentage of causes of infertility will be 30% and the fallopian tube will be 25 to 35%. Almost ovary fallopian tube both will be 30% only. Okay, and uterus it will be 10%. Cervix will be 5% and the vagina will constitute about 1%. Okay, in this slide, mostly what they are going to ask as an MCQ is see, will the vagina will be involved in causing a female infertility problem? Okay, yes. So many people will not know whether all the parts are involved or not. Okay, so vagina only 1% and they'll be asking the percentages which has the highest percentage or what is the percentage of the fallopian tube that is involved in the infertility is about 25 to 35%. Ovary is about 30%. Okay, mostly they'll be asking these percentages also. Okay, we'll come in detail now. Okay, first we'll see the ovary. How the ovary is involved in the infertility. As always, I split and explain. I divide and explain. Same formula. That is, ovary may result in an ovulation or oligo-ovulation. Why? Why this anovulation or oligo-ovulation is coming? Because see, this is the, if we say, this is the pituitary. Okay? And this is the oval, right? So what happens is this pituitary hormones will be acting upon the ovary like gonadotropins. It's like FSH, LH will be acting and then it releases some of the hormones like estrogen, progesterone. If there is any problem in this gonadotropins because of hypothalamus, because hypothalamus secretes GnRH secreting hormones. So GnRH hormones will be released here. GH hormones will be released on the pituitary and then this pituitary will stimulate the gonadotropins. Then these help in stimulating the estrogens and progesterones in the ovary. If there is any problem, of HPO axis, that is hypothalamo-pituitary ovarian axis, it results in infertility. Because no ovary, that is no hormones, no pituitary hormones, no ovarian hormones, what happens? That nidation will not happen properly. So what happens? It results in the female infertility and some of the other problems like elderly age, PCOD or premature ovarian failure. Premature ovarian failure may also cause the infertility. Some of the examples. And the second is that is luteinized unruptured follicle. Luteinized unruptured follicle. What is this? See, this is the ovary. Okay, see the follicle. What happens is in this follicle the ovum will be there. Ovum is trapped. Ovum is trapped inside the follicle, get luteinized. It will be trapped inside the follicle. This is the follicle and the inside one is the ovum. it gets trapped inside it, it gets luteinized. It is seen in the conditions like pelvic endometriosis. Okay, and some other conditions like hyperprolactinemia because of the hormonal disturbance. Hyperprolactinemia. So mostly ovarian causes are, one is oligoovulation or anovulation. Okay, why is because of disturbance in the HPO axis. Okay, this is the one, and these are the examples. And luteinized unruptured follicle, it is pelvic endometriosis and hyperprolactinemia. Okay, these are the ovarian causes which constitute about 30%. Now let us see the causes of fallopian tube. Why I have kept image to every part? Because some people, those who are preparing, those who are undergraduates, just entered into the final year, they will not know the parts properly. So I am explaining everything with a clear image. Okay, see, this is the fallopian tube. This is the ovary. Okay, see, in the fallopian tube, there may be peritubal adhesions. See, what are the causes? There may be peritubal. Peri means outside. There may be, first point, peritubal adhesions. Second point, endosalpingeal damage. Okay, see, this is the endo. Inside of the fallopian tube is the endosalpinx. Okay. Third one, previous tubectomy patients. Tubal polyps or any mucus debris accumulation. Mucus debris accumulation within the tube, within the fallopian tube. And next is, see, peritubal adhesions, endosalpingeal damage, previous tubectomy, tubal polyps may be there, and any mucus accumulation within the fallopian tube or infections of the tube like infections of the tube like mostly in our country most common infection is tuberculosis, most favorite question of SPM, and also in obstetrics and gynecology part, tuberculosis is very favorite to all of them. They may be asking so many questions in tuberculosis. And next is chlamydia, and next is gonococcus. Okay, so these are the causes of the fallopian tube. So first is the peritubal adhesions, endosalpingeal damage. Previous, sometimes tubectomy may happen. Okay, some polyps may be present. Okay, or some mucus debris may be present in the tube, and infectious conditions may also present in the tube. Next is the uterus. Uterus. Uterine endometrium should be very perfect for nidation. Very perfect. Perfect means nothing. All the layers or the hormonal support should be good. This is the uterus where the baby will be growing. So perfect for nidation. Nidation means the zygote or implantation, everything nidation, and the growth of fertilized ovum. Fertilized ovum. Okay. Next, how does the uterus results in infertility is, first point, there may be congenital anomalies, congenital malformations of uterus like unicornuate, bicornuate, septate uterus like that. And other is next, there may be fibroids, there may be adenomyosis, endometriosis. Okay, endometriosis, and also the infections. Okay, infectious part like endometritis or some collection of the pus inside pyometra, like that it may happen. So uterine malformations are the most important causes of infertility. In that it may be unicornate, bicornate, or septate uterus may result in infertility. There may be fibroids, adenomyosis. How fibroids means a fibroid will be there here means the baby can't grow inside because it will be compressing. So adenomyosis, endometriosis and infections may result in infertility. Next is the cervix. 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 See, this is the cervical part. Okay, this is the cervix. When we take it, when we observe, it is like this. Okay. So cervix, it results in again two, that is the anatomical and the physiological. Both will be involved in case of infertility. Physiological. We'll see. Anatomical, there may be congenital elongation, of cervix, or sometimes what happens is uterine prolapse, such that in dividing the uterine prolapse, it may first degree, second degree, third degree will divide it. In that, in one of the degree, cervix will be completely outside. So uterine prolapse. Okay. Next, in case of physiological, what happens is the problem lies in the composition of cervical mucus. See, what happens is there may be excess cervical discharge, excessive cervical discharge in case of infections leading to cervicitis. Okay, so excessive cervical discharge may be there, and sometimes what happens is scanty discharge. Scanty discharge like amputations of cervix, conization of cervix. It may result in scanty discharge. Okay. They'll ask what are the anatomical conditions of cervix which lead to infertility. What are the physiological conditions? Where does the physiological it lies is cervical mucus. And the other is presence of anti-sperm antibodies. Okay. Next. Last is a vagina. Very less, only 1%. That is also why. See, this is the accept vaginal opening. It should be like this. But some conditions like, see, narrow conditions will be there. That is vaginal adhesions, longitudinal or transverse vaginal septum, and third is narrow vaginal introitus. These all result in dyspareunia to the patient and lead to infertility. For your clarity, have kept, see, this is the opening which should be like this. But see, this is the presence of the septum. See, this is the complete vagina which is enlarged. Okay, but what happened? Because there is a septum here. Okay, septum, longitudinal septum. Like this will be, it is transverse septum. Okay, or there will be vaginal adhesions will be present in this. Or sometimes there will be narrow introitus leading to dyspareunia to the patient. Dyspareunia means there is no frequent coitus, and so there is problem leading to infertility. Okay, actually the infertility is very long topic. I am making a very short to explain you clearly. And next is we'll see some other topics like treatment or anything. Now I would like to end this session. You all remember the percentages and what are the exact causes of infertility. It is helpful to you all in your Viva, your 4 marks examination, and also to your multiple choice. Okay, thank you.